Jamie Spinelli, and I'm the Homeless Response Coordinator for the City of Vancouver. My role here is kind of twofold. So I lead the city's homelessness assistance and resource team, the HEART team, and we're kind of the city's own outreach arm. So we provide services and outreach and referrals for folks who are living outside. We assess camps, both active and abandoned, for cleanup needs and then coordinate those cleanups. And then we serve as the city's kind of one point of contact for community members, just like you all. If you have questions about homelessness, what the city is doing in regards to homelessness, you need to report a camp or someone who might need assistance or whatever. And then the other piece of my job here is making policy recommendations to city management and the council, and then operationalizing those things. So for example, last year, I presented kind of a plan for addressing the impacts of unsheltered homelessness to the council, which was approved, and so we're in the process of operationalizing some of those. So we do the Safe Park site, where people can live in their cars at a parking lot, which is staffed, and most recently we're standing up the Safe State communities, which is the little kind of shelter villages that have opened recently.
Officer Tyler Chambers, Vancouver Police Department, began here in January of 2004. I see Brian Schaefer's on the line there. He really should turn his camera on. No? Okay. I was a neighborhood police officer for 5 years prior to becoming the Homeless Assistance Resource Team Officer. During my time as the neighborhood police officer of District 1, it was back in 2015 when the homeless crisis really, and the unsheltered homelessness we see on the streets really became more visible, and everybody was grappling with what to do with it. We quickly realized as a police department that arresting ourselves out of the situation was a no-go. Putting people in jail for 1 or 2 nights was not solving anything, and in fact it was cumbersome and expensive. It was creating a lot of distrust. And we were really just were spinning our wheels, and frankly, it's a social issue, not a crime or criminal issue. So law enforcement still has a function with regards to the liaison between the outreach community and housing and a whole bunch of other stuff, partly because of land ownership and jurisdiction. It becomes whether or not is it state property, is it city property. Is it private property? Is there implied invitation? Lots of different things to navigate because of constitutional law that protects everybody's rights. Best practices across the United States, having HEART teams or HOT teams or whatever name they would give them. Law enforcement is often a component of those teams, but it's certainly not the front. It's really a secondary function. So.
Good evening, my name is Mike DeLay. I am the Program Director for Columbia River Mental Health Services Substance Use Disorder Department. So I oversee the clinical services attached to our North Star Medication Assisted Treatment Program, as well as our mobile health and mobile crisis teams. So I've had the opportunity to work in this community in behavioral health services, either specifically targeting or adjacent to homeless services for about a decade. I started off as a homeless outreach worker on the PATH team back when Jamie was still cool enough to do that stuff with me. And transitioned from homeless outreach, housing coordination into drug and alcohol treatment services inside the Clark County Jail, where I had the opportunity to work with a lot of the folks that I'd been working with outside in a more stable environment and see some of the opportunities that came with a little bit of stability and a little bit of engagement inside that facility. Then had the opportunity to transition to a different role that they were dumb enough to allow me to build my dream, which was mobile behavioral health services in the community, specifically geared to meeting people literally where they are at. So our mobile health team is countywide. We spend part of our time in the city of Vancouver, obviously, but we're also up in Battleground, Camas and Washougal area. It's a team comprised of a mental health practitioner, so a licensed mental health practitioner, a drug and alcohol counselor, a peer support specialist, a nurse, and a part-time prescriber. So all in one van traveling around, we have basically everything an individual might need to access in order to start stabilizing their physical and mental health issues. And really the goal with this team is also to act as kind of a pre-crisis service, right? Because crisis services are stretched thin across every community, specifically in our community. The emergency rooms are overwhelmed, right? Hospital services, they're taxed. Emergency ambulance services, they're overwhelmed. So by going out and helping people in the moment with some of the minor issues and providing them the opportunity to address them before they become major life-threatening issues, we're reducing the overall strain on the system. We're also preventing them from getting caught up in restrictive levels of care. Because an individual who has a behavioral health crisis, right, it becomes so acute that they start to act in a way that is quote-unquote socially unacceptable. And when that starts happening, then people start calling the police. They start calling for designated crisis responders. And as soon as that contact happens, the individual who's experiencing a behavioral health emergency, right, like a crisis of the spirit, a crisis of the mind, may suddenly have their rights stripped away. They may be involuntarily detained with their best interests at heart, right? But still, like taking away somebody's rights, that's a huge thing to do. And then it gets them involved in maybe the legal system, or gets them involved in the acute care system. And there's a lot of structure and restrictions that come along with that carry beyond the moment of crisis, which just adds another layer of weight and burden and constriction to an individual who's already experiencing an enormous amount of that. So with teams of this nature, the goal is really to reduce the barriers to helping people access supportive services and also reduce their interactions with restricted levels of care. And that's what's really exciting about having a mobile health unit and rolling out overnight crisis units that are able to interact with individuals and they don't have that component of restriction attached to them.
Hi everybody, I'm Adam Kravitz. I'm here in a couple of different capacities. My organization is called Outsiders In. I am a longtime resident of Vancouver. My residency at times was as a renter and at times was as a person living on the streets. Probably half and half of that time. Our organization was born out of wanting something different, as some good folks have spoke earlier about when the homeless crisis really started and how that came about. My experience was just earlier than the crisis really started, and I had a lot of thoughts and feelings about what could be different. Our organization took a long time to grow and build, and what we focused on was advocacy and building the voice of the folks that were still suffering, telling their stories, using social media, attending events, helping change laws, speaking at city council meetings, writing letters. We spent years educating ourselves about how the system works, where the money comes from, how to be involved in that. And then currently, what we are today is we have, currently today we have 5 programs going. 3 of those are shelters. We operate mail service in Clark County for anyone who needs an address. But folks can pick that up 6 days a week. And we have an outreach program with folks out on the street, literally out there talking to folks and supporting them, encouraging, building relationships of trust so we can then, again, address those barriers and those things that are getting away and from helping folks be stable and supported. Our 3 churches, our 3 shelters, one is our men's St. Paul shelter downtown that used to be part of the Winter Hospitality. It's still part of the Winter Hospitality, but also operates now year-round instead of just in the wintertime. Our newest shelter, which you might have heard about in the news, is the Safe Stay Community, or what we call the Outpost affectionately. And that is 20 individual units for folks to stay in, get supported, get stable, and get support and encouragement and have some hope and dignity. And coincidentally, the 3rd shelter is in the other room. right next door, and that is our satellite overflow shelter. I love this neighborhood that they have their meeting at the same time as an operational shelter. That is, for me, is the most important bridge gapping that can be done, and to show other neighborhoods that we really have nothing to fear. This is their satellite overflow shelter that holds 15 people, travels between 3 churches during the week, and this particular shelter holds folks that normally don't always get shelter, folks with pets or couples. We need more single women shelter spots, so this also is an area for them to come as well. So that kind of gives you a snapshot of us. The other cool thing about my organization is that we really, at least 95% of the folks that work for us are folks with lived experience with homelessness and or mental health, addiction, incarceration, and other barriers. So when we support folks, we come at it from that pure lens of that shared lived experience and that who best to help folks except for folks that have been there. But that's not really true. Everybody in the community helps just as well. We just have a different staff.
Ty Stover, Mayor Pro Tem for the City of Vancouver. Let's see, so what is the role of the City Council? So first, the City of Vancouver is under state law not the primary provider of homeless services for Clark County. That is Clark County, unless the City of Vancouver decided to break away from the county and write its own homeless services plan. Obviously, a lot of responsibility comes with that. At the same time, we don't have the leisure of ignoring the issue. A lot of folks in our community, I mean, this is, if you ask folks going door to door and knocking on doors and ask people what's their primary concern about the City of Vancouver, homelessness is going to come up at the top of that list. And that has only grown over the past several years. December 2014 is when our eyes really started to be opened about the true nature of the housing crisis that we've had. That was in December of 2014 is when the Seattle property management company, who had recently come to town, sent eviction notices to half the residents of the Courtyard Village to be out by the end of the month. And followed that up in January with sending eviction notices to the other half of the residents there. We realized that we had a less than 2% vacancy rate in the city. There was no place for us to put those people. It's taken a long time, but the city finally has come to the point where we're like, okay, we can't keep waiting on the county to come and save us. And we've got to start doing things on our own. We've got to start trying things that the county actually doesn't like us trying. The Safe State community, I'm not sure if anybody from the county has even come to view it because they feel that we're encouraging camping with it. But we can't stay. You also know we tried the navigation center. So the city is, we are not experts. Okay, so we're learning through this whole process just as everybody else is. The navigation center, a lot of good intentions. It didn't have all the right community supports around it, unfortunately. So it was something that we tried. But I also realized that there are no day centers that I know of operating that aren't attached to housing. And so here we were trying to operate a day center devoid of housing, and so at 5 o'clock we would shut the doors. People didn't have any place to go. So I think, well, I don't just think, I know the model we're now running with the Safe City Communities is a much better model because people have some place to go and the services come to them.
I wanted to understand, how are these different agencies or different groups working together, or are they? Maybe they're not working together, but I had a great sense that they really are trying to work in a cohesive manner. And I think, as you just said, Ty, yes, maybe the city makes a mistake. I think, as we as citizens, we have to be very careful and say, well, you know what? Let's be careful in our judgment, and let's see what happens. And it's a fine line. And so, maybe, Counselor, you could kind of help us. Okay, so what is the true economic impact? What is the life impact that's happening here? And I think, for me, it was also to understand without judgment, but to listen. And then more importantly, what can I do to help? And I think, is there hope for the homeless? I believe there is hope for the homeless. I really do. So I think one of the questions I had was, is it working? Is it working? Do you feel like we are on a path to success? We all look across the river to our neighbors in Portland, and there's been some announcements as to what's going to be happening in Portland. But you know what? That's Portland. Let Portland deal with Portland. I really don't care about Portland, to be honest with you. I care about Vancouver, and I care about the people of Vancouver. So, is it working? How are you guys working together to bring and be on a path of success?
And this is why I think, yes, it's working and it's going to continue to work, and here's my reason why. In 2015, this man, barely off the streets, invited me to coffee, Tyler did, and he gave me 2 hours of his time and asked me questions and told me about himself. That was a big deal in my life. And you know how many times I might not have been arrested. But, this guy I met the same way, and then we invited him to take part in our homeless memorial in 2015. Jamie was feeding me peanut butter and jelly sandwiches in the park when I was homeless, and some date I can't remember. And Mike, I've had the pleasure of working with on the mobile crisis team when I was working my other job. So the reason that I know it's working is because unlike other places, cities, counties, organizations, groups, we have a relationship. We have relationships where we're all on the same page. And I think that is like the key why I think it'll continue to work. But like, I'm on a panel of people I'm like familiar with and friends with, and it feels different and new, but exactly as it should be. That's my short answer.
Yeah. I think Clark County, especially in like Vancouver, has a really unique opportunity. In a lot of places that are a little bit bigger and the systems are more dynamic, you have a lot of transition, you have a lot of shifts in faces, names, goals, agendas, right? I've known Jamie for, 9 of my 10 years working here. Like Adam and I have bumped up against each other probably almost as long in different capacities. Tyler, like when you first started, I remember your name popping up, but we all started off at a very foundational, like basic level, like boots on the ground level, and stuck it out and worked our way up. And so now we're in positions where we've kind of professionally grown inside of these systems and have earned our spot to say like, no, this doesn't work. Like, this is stupid. Why are you still doing this? Let's do something different. And before it used to be like, you be quiet, do what we say. Now it's like, okay, yeah, let's give it a shot. And I can sit down there and talk to my bosses, and they'll give me a little latitude, and I can call Jamie and be like, Jamie, I got a really dumb idea. And she's like, no, it's not dumb, do it! And I'm like, oh crap, here we go, now I gotta do it. And we can go out in the community, and there's faces that aren't on this panel that are active in the homeless service community that have that same experience, that we have that same historical context with. And it's a community of peers. And I think that connection really makes it so that we can work together in an effective way, where it's not just strange organizations trying to figure out where the rough edges meet. It's, I remember you from back in the day, or I know you're solid because we used to go into some questionable places together and you had my back then, right? And now we're in a place where we get to affect some kind of larger scale change. And it's larger scale change that gets to get created from a community of trust amongst the individuals creating it. And that, I think that makes all the difference. I mean, it makes a huge difference in how you can operate in the sphere, so.
Yeah, I can tell a lot of stories about why things are working, but I want to also recognize something. For the last 2 years, we've all been in the middle of this weird thing called the pandemic. And it was like a freight train was just starting to get up and running. 2015, 2016, 2017.
Tyler, could you grab a microphone?
And then, just, and boom, all of a sudden the train just immediately stopped. It stopped at the federal level, it stopped at the state level, it stopped at the county level and the city level. It just stopped. And it derailed a whole bunch of stuff. And so it's taken some time to turn that back on. I just want to recognize that when we say it's working, we see what's going on behind the scenes. Citizens, and I'll just be frank, they see garbage up and down our highways, and they blame the homeless. And they see homeless camps in Vancouver, and they go, what's going on? And they don't see like progress necessarily. There is progress, and like I could go on about all the details about why I believe that. These guys have already said it. There's relationships, there's more resources, there's a plan. We're marching forward, and I'm excited because for 7 years what I saw was nothing. I saw disorganization, I saw chaos, I saw bureaucracy. I'm a taxpayer, I got kids in this community, I'm invested here. I got kind of passionate and upset because it's like, hey, people deserve better. I deserve better, our community deserves better. The people living outside deserve better. People don't deserve to live like that. This is ridiculous. We got a broken treatment system, broken mental health system, broken law enforcement system, broken housing system, and all of them need to be worked on, not just one. This isn't like Ty said, who owns it? Don't touch it, because then you're going to have to own it. At least take a step back, and there's one guy standing forward, and now it's yours. So I will just say this, all right? The best meal you've ever had in your life was not out of the microwave. It took some time. And if you wait for it, right, the results will come. So it's happening, but it's sort of like in the oven. Can't see it yet. The oven's on, the light's on, but the trash isn't gone yet, the camps aren't broken down and gone yet, but we're getting there. Yeah. So I'll just stop there.
Why are you hopeful? And I really do believe that you are hopeful that we can do something that helps change lives.
I am so hopeful for all these safe state communities that we have going up right now. Like Adam and everybody was saying earlier, we all have lived experience, and watching people have hope potentially getting into a home to be safe, be warm, have a shower, have a place to cook, and just lock up their belongings and decompress from life is incredible. And I am thrilled to be a part of it and to be a part of this amazing team.
I am hopeful for so many reasons. I'm hopeful because I know that what we've been doing, what we're doing, and what we've been doing this year especially, in this collaboration that is unheard of, is we are changing the perception of homelessness. And in doing that, we're getting more and more people on the side of, well, our side, and then the momentum is going to continue because people are seeing that we're doing the right thing, we're doing it together, and as we do it together, and we keep squashing what the stereotypes of homelessness are, and we start letting people know that what we're out there doing is we're in a humanitarian crisis. We are doing what would happen during any natural disaster. We are working on disaster, not only preparedness, but mitigation. And then what we're doing with the folks that we work with is we're providing stability. Stability to recover from homelessness, because homelessness is traumatic on so many levels, and it doesn't stop until you get stability. And so these safe state communities are about providing safety and stability, and that's why I'm hopeful.
I'm hopeful because I've been watching people get better in Clark County for 10 years. Like, despite all our efforts to screw it up, get in their way, building dumb systems with stupid rules that doesn't help anybody, right? People got better despite us. And like, now that we're kind of getting on track and doing things in a more intentional, more collaborative, more evidence-based way, how can more people not get better? Like, people recover from substance use, people recover from mental health, people recover from homelessness, and it's a possibility for anybody who's experiencing it right now. Like, recovery from any of these and all of these happens, so how can you not be hopeful?
I'm hopeful because this is happening tonight. These conversations are happening, and her and I have talked about this. We don't care if people are super glad about what we're doing or super unhappy, angry, mad, ready to set us on fire and throw us in the river. The conversations are happening. That's the magic. But those conversations need to be had with the right people. People like Ty Stober who are listening, your mayor, your county council, your state, your governor, right? Whether you voted for him or not, the guy called the homelessness the #1 priority going into the next session because that's what he's hearing from us. I'm not saying my hope's in the government. I'm saying my hope is that people have woken up to the fact that this is a humanitarian crisis. It's not some problem. It's not a pothole to fix. And it's going to take the will of the people to have the complex answers to the very complex issue that we're facing. And I'm excited because, like Mike, I see it happening. I wish everybody could see it happening like I see it happening, but then you have to do what I do that I don't wish on anybody.
I am hopeful, probably for a lot of reasons. I can think of a few. One of those is that I've been doing this kind of work at Homeless Services here for around 12 years now, 12 or 13 years. And when you are a boots on the ground employee and you are seeing what is happening all day, every day, and then policy comes down from above, from high up above, from people who have absolutely no idea what is happening, that's super frustrating. And I am just in the last 2-3-ish years starting to see leadership pay much more attention to the people who are closest to the issue, whether it's people with actual lived experience or people who work directly with those with lived experience. So that is very exciting. I am excited to see, as Tyler said, this is being prioritized and treated as an actual crisis. And then I suppose just the hardest and the greatest part of my job is the pleasure of seeing lives change, lives that I have worked with for my entire career be better today than they ever have been, just because they've gotten a tiny bit of stability. And it's only one person at a time, so that can feel like, because the problem is giant. But if you have the opportunity to get to know just some people and watch their whole lives change, it is the greatest thing you will ever see.
Again, I'd like to thank each of you for coming I think conversation is a big thing. It would be probably great to maybe in 6 months to come back again and see what is going on.